We will be talking a lot about eating disorders, and I think so this is very important to know the different etiological factors and how they are interrelated in understanding and doing research on eating disorders. As I could make out from Professor Nusrat's talk, that what we are lacking is the research area. So I would be talking about the different gaps in research and what are the different lacunas that as researchers we have to face while doing research on eating disorders, and why this research is not being taken up on priority basis in Pakistan, in spite of the fact that the prevalence is quite high, and especially it's very high, around 9% among youth, the youth that is sitting in front of me. So the topic of today's talk would be on a critique of the literature on etiology of eating disorders. Yes, आगे नहीं जा रहा मैं. Okay, some of the common eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorders. So basically, if we consider the definition of eating disorders, there is a significant problem with eating and being overweight or underweight. And eating disorders are one of the significant problems in care of adolescents as well as adults. I'm talking with reference from Pakistan also, and eating disorders are defined by disturbance in eating patterns and either excessive or insufficient food intake. Both DSM-5 and ICD-11 have defined anorexia and bulimia as conditions on the basis of weight, and binge eating disorder is an eating disorder that is characterized with recurrent urges of binging without purging. So talking about the prevalence, because this gives us an insight why it is important to study and do research on eating disorders, is that the prevalence of anorexia and bulimia is around 0.3% to 1% in adolescents and young people in Western countries. Prevalence rates of anorexia nervosa and bulimia nervosa increased during the transition period from adolescence to adulthood, and lifetime prevalence is found to be higher among women compared to men. So there is a dearth of empirical statistics on incidence as well as prevalence of eating disorders in Pakistan. Although a number of surveys have been conducted, but still the comparative features are inconclusive, and the research still remains inconclusive because of a number of factors, which I will be discussing later. One study conducted in Karachi reported a prevalence rate of 7% of eating disorders in female college students, and another study that was conducted in Lahore found out a prevalence rate of 9.3% of eating disorders and attitudes among university students. If we see the mortality rate of people with anorexia is quite higher than that of normal population. Like it is estimated that 10% of people with anorexia die within the 10 years of diagnosis. Mean crude mortality rate is 5% for anorexia, whereas 46.9% of patients do have full recovery. On the other hand, 33.5% patients only improve, and 20.8% have a chronic course of disease. These are the people that can be subjects of research on eating disorders. In a survey conducted in Canada, it was found out that when the people were studied over a period of 20 years, there was higher mortality rates in patients with anorexia as compared to the normal controls. The mortality rate for bulimia is generally lower than that of anorexia, but again, it is around 2%. Challenges of longitudinal studies. This is very important for the students to understand that what are the challenges faced by the researchers who are doing research on eating disorders. So if we do longitudinal studies, 20 years of follow-up, there is disconnection of cases with research groups because of moving away, reassessment of again diagnosed patients over a period of 3 times over these 20 years. And there has been a change in the diagnostic and statistical manual. A number of revisions have come up, and all these other concerns of researchers. Talking about psychiatric comorbidities with eating disorders, it is known that depression, anxiety disorders, obsessive compulsive disorders, substance abuse, and attention deficit hyperactivity disorders are found to be comorbid conditions for eating disorders. Suicide and suicide attempts are dangerous comorbidities for this disorder. Primarily, the cause of premature death in eating disorders are medical comorbidities, and usually this is even more higher in patients with anorexia. There was a meta-analysis that was quite interesting, and the results showed that 42 published studies of mortality of eating disorders determined that the second most common cause of death in eating disorders is suicide. About 10 to 20% of the patients with anorexia and 25 to 35% of patients with bulimia have a history of at least one suicide attempt. So it is extremely important to study these cases. An accurate suicide rate of eating disorders is very difficult to find out. That's why there are hardly any statistics available for Pakistan because of unreliability of suicide statistics in general, as well as difficulties in uncovering the exact cause of death and undiagnosed cases of eating disorders who commit suicide. There are other medical comorbidities with eating disorders like anemia, electrolyte disturbances, cardiovascular disorders, endocrine dysfunction, and other medical conditions like in anorexia, there is weight loss, severity of being underweight, and duration of eating disorder, age of patients, and the intensity of purging are important conditions that should be considered while doing research on eating disorders. I won't be going in length into the other medical complications associated with these disorders, but physical examination shows that these patients have dry skin, they have alopecia, that is loss of hair, and there is erosion of dental enamel, and there are cardiovascular diseases like bradycardia, and there are ECG abnormalities also found in these patients. Some gastrointestinal system impairments are important to highlight. These include gastric emptying, pancreatitis, and esophagitis, and delayed gastric emptying. Blood concerns are also there, low glucose levels, and there are other conditions, metabolic acidosis, etc., associated with these. Extremely important is to study the biological factors because eating disorders are biologically, they are found from one generation to another generation also. So genetics play a very important role, and the link between genetic factors and eating disorders is very important to study. Twin studies are usually carried out for finding out the biological factors and the contribution of shared environmental effects. That means that the twins are usually living in the same environment. Maybe how are we going to rule out whether it is due to genetics or whether it is due to being living in the same home environment. And non-shared environments like stressful life events are often small, but these effects need to be studied when we are doing research on biological factors. One of the limitations of twin studies that all the researchers and students sitting here, specifically our MPhil, MS, and PhD students, they need to know is that usually the follow-up period of these studies is very short. Some cases that are not concordant may turn out to be concordant later, and unaccounted cases may affect heritability estimate for eating disorders. Small sample size is another limitation, and study of larger sample size that preferentially includes different racial groups can be more helpful, because if we are talking about genetics, then maybe different ethnic groups may have different prevalence rates of eating disorders. Coming to neurobiology, serotonin plays an extremely important role. It mediates anxiety reaction, problem with response, inhibition, aggression, suicidality, heightened vigilance, and self-injury. Several studies have confirmed persistence of alterations in serotonin activity and also persistence of anxiety, perfectionism, and obsessive behavior after recovery from anorexia and bulimia. So there are changes in serotonin level. Serotonin may indirectly mediate its effect on development of eating disorders through some personality traits. It is extremely important to study the personality traits associated with eating disorders. Among different experimental studies, because experimental studies are usually carried out to find out the neurobiology and neurobiological basis of eating disorders. So alteration of mesolimbic dopamine and serotonin as a result of restricted eating coupled with excessive exercise in activity-based anorexia model are the models that are useful in studying eating disorders. So experimental studies of possible functional alteration of serotonin due to aberrant eating behaviors are costly and invasive. And that's why, because here we do not have much fund for research in Pakistan, so it is difficult to carry out these studies. But these studies can contribute towards understanding of complex relationship between functional alteration of serotonin and eating disorders. Body image disturbance, specifically highlighting because these are the concerns that are quite prevalent among the youth that is sitting in front of me. The degree of body satisfaction or dissatisfaction plays a very important role in onset of eating disorders. So the results of self-assessment determines body satisfaction or dissatisfaction and how these factors can lead to different eating disorders. Different prospective studies have been carried out on women. They have found out that dissatisfaction, ineffectiveness, and public self-consciousness are associated with symptoms of eating disorders. Like Dr. Nusrat has talked about the physical appearance and use of creams in order to look more fairer and to look more slim. So these are the factors that are usually prevalent among our youth that might lead to eating disorders. So disapproved body image disturbance as a predictive of later eating disorders after 2-year follow-up of college students have been found out. Another problem with these studies is to find out about whether there is a link between body image disturbance or satisfaction or dissatisfaction is that thinking patterns of youth keep on changing due to developmental processes, and studies that collect data is in very early adolescence and follow up patients into the later adulthood are difficult, and the thinking patterns might change over a period of time. So different studies have been found out. In prospective studies are required to find out what percentage of these adolescent girls and boys will develop full picture of eating disorders. These type of studies are extremely important. In addition to huge amount of budget requirement, these studies may face other big challenges, that is convincing adolescent girls and specifically boys to come forward and provide data. Again, this has been talked about by the earlier keynote speaker, Dr. Nusrat, that usually people do not have the mindset of providing the real data in research in Asian population, and specifically if we talk about our own population. As I have already talked about different personality traits as well as personality disorders. So basically borderline personality disorder, avoidant personality disorder, OCD disorder have found to be associated with eating disorders. And traits like impulsivity, novelty seeking, stress reactivity, and harm avoidance, perfectionism are other traits that are associated with eating disorders. So if somebody is interested in doing a research on finding out the personality predictors of people with eating disorders, so they can assess personality traits in their subjects during the illness. That is maybe what changes are there because of the onset of eating disorder. So therefore, the personality traits could be a reflective of the adverse effects of starvation also. So while formulating studies on eating disorders, minute details and minute important things and comorbid conditions as well as personality features need to be kept in mind. So another important factor that needs to be researched in eating disorder is developmental factors, and traumatic experiences, physical and sexual abuse, and child sexual abuse has found to be associated with eating disorders. So some studies have shown a strong relationship between child sexual abuse and eating disorders, while other studies strongly refuse. So there still remains a room for the students who want to study, so as the comparative features are still inconclusive of research on eating disorders, so they can study that part. So discrepancy between the results of various studies, why these studies, some of the studies refuse that child sexual abuse is associated with onset of eating disorder, maybe because of the use of different operational definitions to define child sexual abuse. So a well-designed research project with consideration on the subject's ethnicity, origin, age at the time of sexual abuse, these are the covariates that we usually tell our students to look at the covariates, कौन से ऐसे covariates हैं जो कि important role play कर सकते हैं, that can confound the results of the study. So they can be socioeconomic class, that is very difficult to study because we have to take a number of parameters in order to study socioeconomic class. Family dynamics would contribute to the understanding of possible relationship between eating disorders with child sexual abuse. Challenges of research on developmental factors may face are accuracy of data. That is again a concern in Pakistan also. Careful examination of variables, lack of victims, confidence to report the abuse. This is again concern in Pakistan. Usually victims do not report abuse to the police nor to the child protection system. And there is no clear-cut definition of child sexual abuse. So these studies suffer from problems of cost effectiveness and being a country in which very little budget is being associated with health. So again, these studies are very difficult to carry out here. So the impact of Western culture, I can see the impact of Western culture in the youth, especially young people. They are very impressed by what are the fashion models and how slim they are and how they look and what are their hairstyles. So these factors do impact on the onset of eating disorders. So rate of eating disorders is quite high in countries like Japan, Iran, and Singapore, because they are really, they get inspired. And I think so one of the reasons for eating disorders in our young women and maybe boys to some extent is also because of these factors. So study of effects of Western culture in relationship to incidence of eating disorders in non-Western immigrant women and girls has started gaining attention. So again, how the people, somebody living in Pakistan migrating to another country, how their culture is going to impact them and whether there can be an onset of eating disorder in those people. Constant exposure to messages and promoting restrictive eating, fad diets, pursuit for weight control can lead to unhealthy relationships with food and body. So there are certain limitations of studies on socio-cultural factors of eating disorders that are very important for the students to understand specifically, that most of the studies have failed to control at least one variable, that is the socioeconomic status, especially family income, which may have a positive correlation with body dissatisfaction, age difference, despite strong link between age and eating disorders. Use of English language at home and religion could also be a potential cause of higher tendency for thinking about dieting and body shape and as an indicator of acculturation. It has been hypothesized that eating disorders have multiple and often shared etiologies, including biological, psychological, development, and socio-cultural factors. A tightly woven network of causes, symptoms, outcome of eating disorder makes the study of etiology of these disorders very challenging. But I would say that many of the students here and one of our keynote speakers, Professor Dr. Amna, has worked a lot with this population. And one of my students has also done her PhD on overweight women. And so again, we are catching up with these type of researches in Pakistan also. Researchers need to use a combination of design. This is extremely important to understand different research questions, obtain a comprehensive understanding of the complex nature of eating disorder because of its multifaceted etiology. So studies on incidence and prevalence of eating disorders in Pakistan are usually based on self-describing questionnaires and face-to-face interviews, because they are less costly. These studies may add to value to identify eating disorders, but these studies sometimes may over or underestimate the prevalence of eating disorders. What I would recommend to the researcher is that mixed method designs can be very beneficial in order to gain a comprehensive understanding of eating disorders. Experimental designs, again, they can be a bit costly, but they help to evaluate the effectiveness of interventions for eating disorders, such as psychotherapy as well as psychopharmacotherapy. Case control designs can help to identify potential risk factors for causal associations. Cross-sectional research designs that are the hot favorite of the students because they are easy to conduct. Again, they can be very important in order to find out the prevalence, risk factors, and related variables of eating disorders. Longitudinal designs are difficult to carry out, but they do provide insight into the development, course, and prognosis of eating disorders. In Pakistan, from 1990 to 2019 and up till 2023, regardless of sex and age group, relative burden caused by eating disorders has increased. As the burden will continue to increase in the future, further etiological studies will be required. An understanding of high-risk groups and onset patterns in eating disorders among these groups would facilitate early identification of individuals who can be prone towards eating disorders, who are at risk of developing the disease. That will help in timely intervention, indeed prevention, leading to the reduction in eating disorder burden in Pakistan. Thank you very much.